and we would like to host Professor Alia and Dr. Mona on this important topic. I know Dr. Alia, she has vast research in this area. So we would like to welcome all the speakers to third Emirates Physiotherapy Society webinar. I will hand over the session to Dr. Ashok to introduce the speaker, and we start this webinar. Thank you very much. And thank you all for joining us on your off day and weekend and giving us your precious time.
Thank you, Dr. Naima. I'm Dr. Ashokan Arumugam. I work as an associate professor of physiotherapy at the University of Sharjah. I'm the scientific committee chairperson of the Emirates Physio Society. As Dr. Naima said, this is second webinar in the series on healthy aging, which continues with the theme of World Physiotherapy Day for this year. So the first speaker for today is Prof. Alia. She's a physical therapist who had a master's and PhD degrees in neurorehabilitation from the University of Pittsburgh in the USA in 2011. She's currently a professor at the University of Jordan. She worked as an executive board member and the chair of education committee at the World Physiotherapy from 2022 to 2023. And she's the vice dean of the School of Rehabilitation Sciences at the University of Jordan from 2018 to 2023. She's the president of Jordan Physiotherapy Society. She was, as well as she is now, up to this year, a board member of the Jordan Sports Medicine Federation from 2017 to 2023, and a board member of the Jordanian Athletic Therapy Association till to date. She has numerous publications to her credit, and the title of her presentation is Enhancing Balance and Preventing Falls in Older Adults. We thank you for accepting our invitation for being a speaker today, and the floor is all yours.
Thank you. Thank you so much.
Most welcome.
So I will start sharing my presentation. Well, I would like to thank the UAE Physiotherapy Society for inviting me to talk about enhancing balance and preventing falls in older adults. Thank you so much, and good morning, everybody. I really thank you for joining us today for this webinar, and I hope that you get a fruitful information from our research. And again, for all physiotherapists who are joining us, happy Physiotherapy Day. And the theme of this year, the World Physiotherapy Day, is healthy aging and falls prevention. And that's actually the theme that we will talk about today. If we talk about the epidemiology of aging in general, globally, based on the World Health Organization, actually, people are living longer, with number of adults over the age of 60 almost doubling between 2020 to 2025 from 1 billion to 2 billion. That's the expected number. It's also estimated that by 2050, about 80% of older adults will be living in our countries, low and middle income countries, including the Middle East and North Africa region. When we talk about the burden of aging, we know that as we age, our bodies undergo numerous changes that can affect our overall health and also our well-being. One of the most significant changes that happens with aging is a decline in the physical function, which can also lead to loss of independence and an increase in the risk of falling. Falls have detrimental physical and psychological consequences that include injuries, immobility, hospitalization, and fear of falling. One of the problems that happen with aging is what is called sarcopenia. It's maybe a definition or a term that is not widely used in physiotherapy, even though it's very important. It was defined as a loss of muscle mass, strength, and function that occurs with aging. This condition can lead to decreased mobility, increased risk of falling, and overall decline in the quality of life. And this is one of the hidden reasons behind the falling and behind the weakness that happens to people with older age. Sarcopenia affects up to 50% of adults over the age of 80, making it really significant health concern for older adults. While sarcopenia cannot be completely prevented, we cannot prevent it because it's one of the changes that happens with aging. However, we can, with exercise, reverse this phenomena, actually, and it has been shown to slow its progression with aging. This is something like, that you can look at. We have two types of muscle fibers. We have type 1 and type 2. With aging, both types actually decrease in number, and the fatty tissues displace actually this types of muscle fibers. So what was the need for our research here in Jordan? The need actually is that many exercise programs have been developed specifically for the older population with a variety of outcomes in mind, such as falls, frailty, and fractures. However, most of these successful and evidence-based programs are developed in the Western countries, with little attempts to adapt and translate for use in Eastern countries, especially in the Arab world. So we know that physical activity and exercise in older age have shown positive effect on health-related outcomes. Therefore, it's really crucial to focus on exercises for older adults. We look for a program that is evidence-based and we can really adopt in our world, in Arab world, and we found what is called Otago exercise program. Otago exercise program is one of the evidence-based programs that was designed specifically for older adults to improve the strength, balance, and mobility. So it works on 3 areas actually for older adults. By participating in this program, it was found that older adults can maintain their independence and reduce their risk of falling and other injuries. The Otago exercise program, also with its focus on strengthening exercise and balance training, can be an effective tool in combating sarcopenia that we just mentioned and helping older adults to maintain their independence and mobility.
Dr. Alia,
Yes.
sorry for just can you give us 5 minutes because we have some technical issue. We need to record the sessions for CME. Just if you give us 5 minutes, please.
Sure.
Yes, sorry about that. Okay, sorry for interrupting.
Dr. Naima, now I'm able to record it. She made a co-host. Okay.
Okay.
So,
Okay, thank you.
please go ahead, Dr. Ali. Thank you so much.
Okay, can I continue? Okay, thank you.
Yes, please.
Sorry about that.
So to talk more about the Otago exercise program, which was developed in New Zealand, it's a series of exercises designed to improve strength, balance, and mobility, as we mentioned, in older adults. And it includes activities such as walking, leg lifts, and squats. It was developed again in New Zealand in 1990 by a team of researchers led by Professor John Campbell. The program is based on research that shows that falls in older adults can be prevented through exercises and physical activity. It consists of a series of exercises that are tailored to the needs and abilities of each individual participant. That's the nice thing about the Otago exercise program, that it can be individualized based on the older adult needs and abilities. To also clarify more about it, as we mentioned, it has lots of balance training exercises because balance training is very important to prevent falls. It has also strengthening exercise specifically for the lower limb muscles because strengthening for the lower limb muscles will prevent falls afterward. Also, it has warm-up, of course, at the beginning. There are lots of flexibility exercises also for the head and neck and even the trunk. Also, it has walking program every other day that we will talk about, that also walking will maintain the muscle strength and also improve balance. So to implement this program, actually, these exercises can be done at home for 8 weeks. And I need you to focus that you can implement it at home. So the nice thing about Otago exercise program, that is a home exercise program. And we hear it all the time from older adults that I don't want to go out for a physiotherapy session, for example, 3 times a week or whatever. So this program was designed to be implemented at home. But in the beginning, of course, there will be a supervision of a physiotherapist who will design the program based on their needs and abilities. The program period is 8 weeks. It is recommended also that exercises are done at least 3 times per week for 30 minutes and walking twice a week. So in the spare days, there will be walking. So again, progress, of course, should be monitored and prescribed over a period of 4 home visits by a physiotherapist every 2 weeks. So again, it's an 8-week program. Every 2 weeks, a physiotherapist will visit that older adult at home and they will progress the exercise difficulty. As you can see here, during the week, the patient or the older adult here, okay, will have Otago exercise program, for example, in day 1 for 30 minutes. In the second day, they will not perform the exercises, they will walk for 30 minutes. Then in day 3, they will do also exercise or Otago exercise program, walking on the first day and Otago exercise program on the 5th day. So again, it has a variety of exercises that the older adult will not be bored by doing the same exercises every day. And again, this is only for 2 weeks. After 2 weeks, a physiotherapist will visit that older adult at home, and then there will be a modification of the exercises to make it more difficult. Because, of course, if the older adult is really doing these exercises, they will get better, their muscle strength will be better. So this is again the levels of Otago exercise program. Again, every 2 weeks there will be levels. So we have level A, B, C, and D, and every level has its own difficulty. So level A will be easy. As you are going from level A to level D, the difficulty of exercises will be more. This is also the areas that we talked about. So again, it focuses on 3 areas of exercises: strengthening exercises, and these are the exercises that will be done. Balance training, also lots of balance training that will be performed by the older adult, and walking, as we mentioned, every other day. At least, as you can see, 2 times a week, there will be walking for 30 minutes. So this is the program details. And even the strengthening exercise in all 4 levels, there will be lots of strengthening exercise for lower extremity muscles. These also other details. So what the aim of the study that was conducted in Jordan? The aim was to translate and culturally adapt the Otago exercise program into the Arab context. Also, to test its feasibility on a sample of Arabic-speaking older adults in a feasibility-controlled trial. This study had institution, of course, review board approval. Also, it was registered in clinicaltrials.gov. The procedures that we followed actually in this study, first of all, we translated all the program instructions and even the exercise prescriptions. Then we conducted focus groups of experts and older adults at the same time to review the Arabic version of that one. And then we conducted the feasibility study, which means that we already gave them a booklet of these exercises, prescription in Arabic, and also with some pictures. So with the focus groups, actually, especially with the older adults, we talked about the clarity of the language. We talked about the graphical pictures, if it is suitable or not, and even the usability and acceptability of all the exercises. And again, we got lots of results from our older adults, and we have modified this program, the Otago exercise program, to be really adaptable to our culture. So as you can see, the study was implemented for 8 weeks. This is the feasibility study in a pilot sample of Arabic-speaking older adults. The Otago exercise group implemented the program for 8 weeks, and they also received 4 videos on each 2 weeks. So every 2 weeks, they received a video, and these are awareness videos. The control group didn't perform the 8-week exercise program, which is the Otago exercise program. Instead, they only received the videos, the awareness videos, every 2 weeks. They received a video, the first one about physical activity, the second one about healthy bones, joints, and muscles, the third one how to combat depression while aging, and also the fourth video was about the quality of sleep. This is the ad that we did in University of Jordan. Let's talk about the participants. The inclusion criteria was, anybody who is 60 years old or older, who can read and write Arabic language, who are able to walk outdoor with no more support than a single point cane, for example. The exclusion criteria to have a serious orthopedic condition or major neurological disorders, or if they are unable to comprehend the study information and consent the process due to any illness, including dementia or Alzheimer's. Well, we had lots of outcome measures that we had at a baseline assessment and a post-treatment assessment. As you can see, of course, we're talking about falling questions, a pain scale, fear of falling, Arabic Geriatric Depression Scale, Arabic Pittsburgh Sleep Quality of Life, Sleep Quality Index, Arabic short form, which is the quality of life one, lower extremity strength using chair balance test, balance using floor test balance scale, timed up and go, handheld dynamometer also for the upper extremity strength muscles, and even physical activity using the accelerometer. So we gave them some accelerometers. These are the results. So again, the demographics, we had only 10 older adults for the control group, 10 older adults for the Otago exercise program group, and in total they were 20. So as you can see at baseline, there were no significant differences between them, and these are also some of the results. As you can see, no significant differences at baseline here, as you can see, except for one at the end, which was the 5 times sit to stand, okay? The 5 times sit to stand, the Otago exercise program did it quicker than the control group, okay? Then we measured also the mean differences for within the group and between a group at the end of the intervention, even though, again, it's only a feasibility study and the sample size was really low because it's a pilot randomized controlled trial, what we did here. And as you can see, some, within a group differences that we found, for example, in Falls Efficacy Scale International, which reflects the fear of falling. Also, we found the HADS, and anxiety, and also the modified fatigue impact scale, we had some differences. Also, as you can see here, pain rating was also different in the control group. So some significant differences here and there, but again, this was not the aim of that study. The aim was to make sure that it is feasible, that it is applicable in Arabic language. So as a summary of the results, the mean age of our participants was 66.5 years old. Males were the majority, 60% of our participants were males. The adherence rate to the Arabic Otago exercise program was 90%. The adherence rate to walking was 50%, unfortunately. And again, the reasons were related to the availability of suitable places for walking or inappropriate weather to walk outside. The improvement of the study sample, the Arabic Otago exercise program had significant better pain scale than control group. The Arabic Otago exercise program also showed significant improvement in fear of falling, in anxiety and fatigue, as I mentioned before. The control group showed significant changes in, for example, they had better timed up and go. We don't know why. Better 5 times sit to stand and worse grip strength. So regarding the grip strength, they had significant worse grip strength after the 8 weeks. If I have the time and you can listen, I want to give you some testimonies, very short testimonies from 2 older adults who did the feasibility study at the end of my study. Let's see if you can hear it. Okay.
السلام عليكم ورحمة الله وبركاته. مشتركة بتمارين أوتاغو مع الدكتورة عليا الغويري. يعني البرنامج كتير عجبني وكتير مفيد، ففعلا يعني كتير مريح. وبعدين إنه يعني كمان خاصة إنه بضلني في البيت بظروف كورونا والواحد ما يتعرض للناس يعني وبالمستشفى وهيك يعني. والكتيب كتير كمان فادني يعني بشكل يعني كبير، يعني لأنه هو يعني شرح تام، وبشكرهم وهني والدكتورة وما شاء الله عليهم، يعني الله يوفقهم.
Another testimony from an 84-year-old male.
أنا مشارك في برنامج أوتاغو مع الدكتورة عليا الغويري. استفدنا منه الحمد لله في التمارين، وصرنا نصلي أحسن، صرنا نقعد أحسن، صرنا نمشي أحسن الحمد لله، صرنا نتحرك يعني أحسن من ما كنا أول.
I'm so happy with this testimony that he mentioned the activities of daily living that became better. So he said that his mobility is better. Now he can pray easily. Now he can move and stand and sit and stand easily also, which was great. So in summary, I'm done, okay? The conclusion from our study that this study translated and culturally adapted the Otago exercise program in Arabic language. A subsequent feasibility study found that the Arabic Otago exercise program is feasible, acceptable, and safe to perform in our population. there was significantly improved pain cognitive skills in the Arabic Otago exercise program compared with the control group. The Arabic Otago exercise program also showed a reduction in their fear of falling and improvement in their well-being, and also at the end of the program. The Otago exercise program actually warrants further investigation, and that's what we did. This study was published actually, and now we are working on publishing the randomized controlled trial. In the randomized controlled trial, we actually have 100 older adults who participated in the RCT, randomized controlled trial. Again, one group did the Otago exercise program in Arabic with the booklet that we provided them, and the other program was, the other group had only the videos. I would like to thank you for listening to me and for our study. And I would like also to show you this barcode that has our research group that is about balance assessment and rehabilitation. This is the research group that was developed at University of Jordan with lots of collaborators from around the world. And this study actually was one of our achievements out of this research group. Thank you so much.
Thank you so much, Prof. Alia, for a very insightful presentation on